Hi everyone, I'm Darshell and I'm going to be presenting on turmeric consumption for weight loss. This video I chose was by Dr. Leonard Kim and it explained the benefits of turmeric in patients with metabolic syndrome, insulin resistance, diabetes, and even PCOS. Throughout the video, he referenced several articles to back up his do's and don'ts when taking turmeric. I'm not going to go through all the articles, but I'll go through some and the claims that I found interesting. The video claimed that turmeric was significant in decreasing weight in patients with PCOS and when taken with metformin can improve insulin resistance and cholesterol. The strongest evidence for taking turmeric was for osteoarthritis and joint pain. He claimed the effects were similar to NSAIDs, especially for patients who can't take NSAIDs due to kidney disease, for example. Taking turmeric could also help these patients be more functional and hopefully lose weight if that's their goal. In terms of metabolic health, it was interesting to learn that curcumin is from turmeric, and it stimulates glucose uptake through GLUT4 transporters and reduces glucose secretion from your liver through regulating the AMPK pathways, similar to metformin. Metformin is a diabetes medication. Towards the end of the video, he went into talking about the proper dose of taking this curcumin, and the proper dose is really dependent on if you're taking turmeric or curcumin. So turmeric is a root in spices, while curcumin is an active compound in turmeric. So I kind of talk about these interchangeably, but the dosage really depends on which one you're taking. So it is important to take curcumin with piperine, I believe, to protect curcumin from our digestive tract. And piperine can increase the bioavailability of curcumin by 2,000% according to this video. It is also important to take curcumin with fats since it can only be dissolved in oils and fats. A safe dosage for curcumin is it's safe up to 8 grams a day, but it depends on what you're taking it for or with, and you have to be aware of the side effects of GI issues. It also is important to note that it does have interactions with several things like blood thinners and blood pressure medications, so please take these at your own risk and consult with your medical provider. This is the article I chose. It's called The Effects of Curcumin on Weight Loss Among Patients with Metabolic Syndrome and Related Disorders. It was a systematic review and a meta-analysis of randomized controlled trials. Okay, so the intro basically of this article is the amount of people with metabolic syndrome, obesity, and type 2 diabetes is growing rapidly. Curcumin has shown to play a role in managing these overweight individuals in these populations, and it is suggested that curcumin intake may improve weight and metabolic status through increasing basal metabolic rate and increasing energy expenditure rate. The methods for this meta-analysis was the curcumin in the chosen trials was powder or extract. So they took curcumin, not just turmeric, and it started with 1,163 articles, and after screening the randomized control trials, 18 were selected with 21 trials being appropriate for this meta-analysis. The results from this meta-analysis showed that 14 trials have showed a decrease in BMI, 15 were a decrease in body weight, 9 showed a decrease in waist circumference, 4 showed a decrease in leptin, and 5 showed an increase in adipocytin levels. The total dose of curcumin intake or curcumin consumption varied in between trials between 70 to 2,400 milligrams per day, and the duration of the treatment among studies was between 4 to 36 weeks.